So today I want to talk a little bit about the scopes that we use in our ENT office. For scoping in the nose, we have two options. One is a rigid nasal endoscope, which is literally a hard type rod that's metal with a camera on the end of it. The rigid scope is about 4 millimeters in diameter, and the physician looks through the eyepiece or sometimes has it hooked up to a camera on a video screen. So sometimes you can actually see what's going on with the rigid scope. There's also a flexible fiberoptic scope which can be used. This scope tends to be more comfortable for patients in the office. Anytime an ENT doc is going to scope a patient, they should anesthetize you. And that's usually done with a combination of a nasal spray that has lidocaine, which is a numbing agent, and a decongestant spray, because oftentimes our noses are just generally congested. So we want to get the congestion down. It just makes the scope go through much easier, and it's less painful that way. If you're seeing a doctor and they aren't offering to anesthetize you, I think that's kind of a red flag. Flexible scope comes in a couple different sizes. There's a pediatric size, which is about 2.5 millimeters, and then an adult size, which is 4 millimeters. Both scopes will go in the nose. The rigid scope is a little more difficult to maneuver into different nooks and crannies in the nose, so sometimes the view is more limited, but in post-operative patients, when they've had surgery done already, it's often the scope of choice. However, in my practice, my scope of choice is the flexible scope because I just think it's more comfortable and I can maneuver it a lot more easily to see everything that I need to see. If you're coming in for a throat complaint or a voice complaint or a swallowing complaint, the physician may want to use the flexible scope to look lower down at your larynx and the back of your throat, the base of your tongue, etc. And that is done with the flexible scope. So it's the same flexible scope that's used in the nose, but it can go further in and down, and we may be looking for any kind of ulceration, any kind of asymmetry. It's important to evaluate the vocal cords and make sure they're functioning properly or that they don't have any kind of nodules or polyps on them. Obviously, we always want to rule out any type of tumor or mass down in that area if somebody has some of those complaints. And so that's why it's very important to agree to have the scope or to go to an ENT specialist to get scoped if you have persistent symptoms of that fashion. The fiberoptic scopes really revolutionized our field prior to me being in practice, way prior to that because I'm so young. Exam was being done using a mirror in the back of your mouth to see the image below. And the nasal evaluation really couldn't be done with any kind of an instrument other than a small nasal speculum that widens your nostrils. So this really revolutionized our field, and we can get a lot more information on examination and diagnose a lot more conditions. I think the wave of the future is probably more of the ability for image capture to be obtained when people are getting a scope done in the office so that they can actually have a digital copy or even a hard copy of what their pathology is, and then they can know what it may show on a subsequent visit and see the difference. Things like that, I think, are coming in the future. There are some disposable flexible scopes that are available, so those are being used in emergency rooms and hospitals for patients, but the scopes are sterilized very carefully in the office or in the hospital if they're not disposable type, and that's all done by a very specific OSHA protocol.